Welcome back. This is Dr. Jackie Gardner-Nix, and I'm talking with Christy Tate, nurse practitioner. And this is our second piece on migraines, the series called Migraine from Both Sides. So we're going to focus on definitions, Christy, and speak about what characteristics you need to be noticing in order for your headache to be called a migraine. Do you want to take over?
Yeah, I'm happy to chat about this. Before talking about the criteria, I think it's important to mention that interestingly, migraine is not very well diagnosed. There's some estimates that only about 40% of migraine sufferers get that diagnosis of migraine. Sometimes they're, called other types of headaches, like a tension headache or a sinus type headache. And as you can imagine, if you don't have the right sort of terminology, then you don't get access to the right treatments. So there is sort of internationally recognized criteria for migraine and features that most migraine sufferers will experience. One of them is a kind of a one-sided headache. So this is the majority of migraine sufferers, but not all. So around 60% will have that kind of one-sided presentation on their head. And then in our chronic migraine sufferers, they often will sort of feel it all over. The other thing that's very common is light sensitivity and sound sensitivity. Although I find that, and we've talked about this, Jackie, the light sensitivity seems to be the thing that is kind of more apparent and more bothersome to a lot of people. So that preference of, maybe avoiding your screen or dimming it or not having, those, when we were all in offices, those bright glaring lights that were bothering us. The other thing can be nausea. And not everyone has vomiting, but sometimes that sensation of severe nausea and vomiting in some people. The other thing that's kind of harder to quantify are some of the functional impacts. So in that criteria that healthcare providers use to define migraine are things like limiting to sort of routine and daily function. So if somebody is experiencing a headache type attack and it's causing them difficulty to work or do, any of their daily functions, that's really in keeping with a migraine. And then typically describing it as kind of a moderate to severe intensity. So those are the features. But we also talked about this, right? In healthcare, it's really nice when things neat and tidy fit into a box and you recognize them. But, you live with migraine yourself, Jackie, and you've seen so many migraine sufferers over your career, myself as well. Everyone has a different story. You might call it by one name, but it's a really different lived experience for everyone. And I think sometimes this is why it isn't always recognized, right? So your experience will be different from mine versus my neighbor. Yeah. Did you
Yes.
find that to be the case as well when you were seeing?
Absolutely, and there are different types of migraines even. Also, you mentioned about photophobia, but for some people, loud sounds are really horrible, and smells too, which can in fact trigger you into a migraine when you didn't have one. Dappling light through the car screen when we're driving, those kinds of things can be triggers for migraine sufferers, but more likely when you're kind of close to a migraine, there may be other things going on, you're more stressed, um, various life factors are coming together to make that day more likely to bring on a migraine, and so on. And so there's so many triggers that we each notice. Now, for me, migraines, the pain is not as bad as the nausea. And yet it's migraine designer drugs that I would use to actually manage the nausea rather than general anti-nauseants. The general anti-nauseants um, don't really help with the nausea of migraine. The other thing that is in a lot of the headache criteria is that you may get an aura, which are sort of visual disturbances about 20 minutes before a migraine comes on. Sometimes I will have that type of a migraine, and I know to take migraine medication during that time because I have stuff that actually works for me, which I'm so grateful for. And you can also have a migraine prodrome, which can be that the day before a migraine hits, you are full of vitality and you are getting everything you need to do. And I often stop during those days and think, oh, I'm feeling so productive today. Is this my prodrome. That's another aspect of migraine. But you're right. I mean, everybody has different experiences and can have different types of migraine. So I have the one that comes on gradually with the nausea, or I have the one with uh, the visual disturbances, which we call the aura, and they're both a bit different in the way, well, certainly in the way they present, but also in the impact of the migraine on me for the rest of the day. Anything else, Christy, that we haven't covered there?
I love that you raised actually a few really interesting kind of features. So that idea of the prodrome, right? So if we, think back to our textbooks, there's this kind of wave that a lot of migraine sufferers will go through, and they may or may not perceive those components, but there's that prodrome phase where people describe cravings, mood changes, energy level changes. If you have an aura, the aura. Then there's what we call the headache phase, although, calling it just a headache is always very diminishing to a migraine, right? So we sort of call it that way, but you're right. The nausea could be really profound. For me, it's light sensitivity, and actually, what I get is a lot of neck pain. And I think this is a really underappreciated feature of migraine. So we know neck pain in the vast majority of patients or individuals living with migraine is a really common feature. It's not part of that diagnostic criteria, but I do get a lot of that. And then there's the post-drome, so the after the kind of severe symptoms of your migraine attack. Sometimes people call this the migraine hangover, where you're just foggy, you're not yourself, your mood might be low. It's the after effects of it. So, this potentially can impact several days. So there might be that most disabling component, which is several hours or a day, but it can go on to have several days of an impact in somebody's
Absolutely,
life.
absolutely, yeah. Sometimes they're short-lived and they'll go in the day, and sometimes several days, as you point out. And my auras where I get my sight blanking out in patches, so it's quite dangerous if I happen to be driving when an aura comes along. Other people will describe what we call fortification spectra, almost like lights zinging across their eyesight. And it lasts about 20 minutes. If you know what it is, it's less scary, but you should pull over if you are driving or stop operating machinery. I mean, these are dangerous aspects to the migraine. And they don't happen for every migraine. So, and there are people who feel on the brink of a migraine most of the time, and then there are others who are very episodic, and there's no sensitivity of the head during between the migraine episodes. And by the way, that's something we need to mention too. There's so much we can mention in this series, but a very sensitive head, where as you touch your skin, it's extremely sensitive, and that can be a chronic part of migraine, or it can come just as the migraine's onset occurs. Let's leave it there for now. That's a lot to take in, and we'll carry on in the next recording. Thanks for joining us.
Thanks for joining, everyone. We'll see you soon.